I wasn't getting out of bed.
I wasn't going to work.
I hid my problems from everyone.
I didn't want people to judge me.
I watched my daughter suffering.
I didn't know what to do.
Because you joined the conversation, we know we are not alone.
We are not weak.
We are not ashamed.
We are strong.
And help is out there. We need to ask for it. Join the conversation. Visit letstalkstigma.org.
Good afternoon. Hello, I'm Frank Camerata. I'm the Executive Director of the Erie County Office for People with Disabilities and board member of the Erie County Anti-Stigma Coalition. On behalf of the coalition, we welcome all the viewers and listeners today as we have another great opportunity to meet with experts in the field and discuss timely concerns. Today, we are focusing on the state of stigma and how it affects older adults as more people experience depression and isolation. We want to share with our audience that help is available. According to the Journal of Mental Health Counseling, it is estimated that half of the 35 million people who are over the age of 65 are in need of mental health services, though fewer than 20% are actually being treated. Additionally, most older adults who have depression never seek or obtain treatment because of the commonly held myth that depression is a normal part of the aging process, and that older adults cannot benefit from psychotherapy. Today, we will be discussing some of the more common causes or risk factors involved and potential ways to assist with our really terrific group of panelists. Before I introduce the panelists, just a couple of housekeeping notes. Our program is 1 hour. During this time, if you have a question or a comment, please type it in the chat box. We will respond accordingly. Your questions and input often lead to very informative dialogue. So please don't be shy. There is no such thing as a silly question, as we're all here to learn today, right? Now, it gives me great pleasure to introduce our panelists. First up is Michelle Abramson. Michelle Abram is a licensed clinical social worker who has been working in the mental health system since 2006. She is intensively trained in functional family therapy and dialectical behavior therapy, and has spent most of her career helping individuals struggling with depression, anxiety, and trauma. Currently, she serves as the Assistant Director of Catholic Charities Behavioral Health. Thank you for joining us today, Michelle.
Thanks for having me.
Next up, we have John Jones, who is one of Amherst Senior Center's social caseworkers, which the job he began in June of 2022. Prior to his position in Amherst, he worked in care coordination, crisis services, suicide prevention, and as a child care specialist. He holds a Bachelor of Arts degree in social sciences from the University of Buffalo, where his concentration was in community mental health. John also enjoys assisting seniors in living their best life. John is an avid outdoorsman. He enjoys hiking, biking, kayaking, fishing, and hunting. Most of all, he relishes time with his grandchildren.
Thank you. Good to be here today.
Welcome, John. Thanks for joining us today. And next up, we have Angela Marinucci. Angela is a proud mom to 3 daughters, ages 6, 8, and 9. And she is the Commissioner of Erie County Senior Services. Angela is passionate about service and making the world an even better place. Prior to joining the Department of Senior Services, Angela was Deputy Commissioner of the Erie County Personnel, and before that, a practicing attorney. Angela graduated from William Smith College with a BA in Public Policy and Political Science, and earned her law degree from American University's Washington College of Law. Angela enjoys endurance running. It's racing too, right? Traveling, reading, and exploring Erie County with her husband and daughters. Welcome, Angela. Thanks for joining.
Thanks for having me.
And we have Kerry Peak. Kerry has her Bachelor of Fine Arts in Communication Graphic Design from the State University of New York at Buffalo. She was born and raised in Cheektowaga. Her career with Town of Cheektowaga started in 1986 as a summer day camp counselor in the Youth and Recreation Services Department. She held various titles there until transferring to Senior Services in 1996 as a recreation instructor. Kerry was promoted to Recreation Supervisor in 1999 and then took the reins as Director in 2007 when the previous Director retired. The Cheektowaga Senior Services Department provides quality programming for residents ages 60 and over in the areas of nutrition, recreation, transportation, health and wellness, education, fine arts, special events, group travel opportunities, and case management services. Kerry and her amazing staff are always looking out for new ideas and programs that inspire and empower older adults. Kerry likes to think of the Cheektowaga Senior Center as a large senior center with a small senior center feel. Kerry says that over her 28-year career with older adults, her love and respect for them has never waned. She still considers it a privilege to serve them, to learn from their life stories, and provide them with a wonderful, vibrant place to celebrate their age and live their best life. Thank you very much, Kerry. That's a wonderful introduction there.
Thanks.
Welcome to all of our panelists, and thanks again for joining us.
Thank you.
So we'll begin our questions. As we begin our discussion, and we are somewhat in a post-pandemic place, I say that because COVID is still active in our community, right? Regarding older adults' mental health, where are older adults at this point? Angela, what do you think?
So I think that the pandemic really just showed a lot of what older adults were feeling even before then. We know that older adults are vulnerable to social isolation in the changing aspects of their lives, with children moving on and jobs with oftentimes leaving the workforce and their social interactions. So I think that COVID-19 really showed us that isolation and that loneliness really has detrimental effects. And so over the last year and a half, 2 years, I think what we've been doing here at Senior Services with our amazing partners throughout senior centers is trying to get older adults to come back into the community and build those social connections. So I think we're in a tenuous place, but we're in a better place in that we're more aware of what some of these negative effects were on depression, social isolation, how that impacted physical wellness, and how we can move forward.
Thanks, Angela. You may need to move closer to your telephone.
I'll move it closer. We'll try.
Yeah, I think that's better there. Okay. Michelle, do you have any thoughts on that?
I do. I definitely want to echo everything Angela just said. Something that we know are the three most common causes of depression is loss, physical health problems, and isolation. And when we think of COVID-19, it did hit all three of those areas. So also to your point though, Angela, I feel like there's more awareness, more acceptance, and a lot more opportunities, especially telehealth. I know in our practice, we have seen a lot of seniors benefit from telehealth, being able to, if they have trouble ambulating back and forth to the clinic, they can still get the help that they want from the comfort of their home.
That's terrific.
Frank, if I can just chime in real quick.
Sure, Kerry, great.
It was worked in reverse as well, though we always felt like we were an integral part of our members' lives and that it was very important to them and to their mental health to be coming to the senior center. Once we were able to reopen and seniors were coming back to us, they were telling us, they were recognizing then the importance of that social connection and you're going to hear us say that over and over again this hour. But the members themselves were saying, were really validating for us what we thought we knew all along, but really saying how much they missed us, how much it meant to be able to be back, how much it meant that the staff was pivoting to try to come up with ways to be able to reach out to them in where they were, right? We were all stuck in our houses, but how are we getting to them? So it really did really show us how important senior centers and places where people come to gather as older adults were really, really, really important to their life.
Okay, Kerry.
I'd like to add, we had the opportunity to start a loss and grief support group. We recognize that people experiencing losses of all types, not only losses of their loved ones, but loss of life as we know it, loss of jobs. So the loss and grief support group really is pretty full. We're able to help a lot of people through that. And there is that awareness and just the idea that they can come and socialize once again. Very important.
Okay, all right, thank you. I had quoted a short piece from the Journal of Mental Health Counseling. And just wondering, are there other statistics our listeners should be made aware of when discussing older adults and depression and isolation and mental illness. Michelle, can you touch upon that?
Sure. I looked up statistics as well, and I guess one that I found that I thought was worthy of sharing was that we're seeing substance use really being a much larger problem in the older population than we ever had been assessing for before. So the number that I saw this morning was 60% of adults over age 65 report what they consider high risk drinking. So alcohol was the most specific substance. And I looked into that a little bit more. I was like, that's a very high number. What made sense to me, though, is high risk drinking is really anything that could put your life in danger, your health in danger. For somebody who may have medical complications or already be on a lot of medication, alcohol certainly does metabolize different and it can be more dangerous. So I thought that was an interesting point to share.
And Angela, I'm going to ask you the same question, as Commissioner of Senior Services, just wondering if you have any statistics you may want to share.
So what I think is interesting right now is that older adults currently make up nearly 23% of the suicides in the United States of America, even though they are less than 17% of the population. It is a rising number among the older adult community. And I also think while we've done a great, and I know this is partially about stigma, but we've done a great for younger generations to talk about mental health and mental wellness and how we acknowledge depression. Much of our older generations weren't around in a time or weren't raised in a time that was as freely conversational. So the actual label of depression or seeking services may seem odd for them, which is why we really talk about that social connection, right? Because there are generations of older adults who, if somebody had some mental health issues, they were hospitalized or institutionalized, and it's a very stigmatizing thing. And so we really need to break that among our older adults, because what we're seeing is that they are still suffering. They're still feeling the effects of this depression, other mental health conditions, but also loneliness without the depression. And if they don't have the words or the tools in which to acknowledge them and move forward, it leads to really terrible outcomes as well. And that is that rise in suicide. Erie County has seen an increase in opioid addiction among our older adults, which often starts innocently enough because of pain medications for whatever, and it continues on. And that is that lack of reaching out and trying to numb something that they are less likely to be aware of, to label, and then seek that appropriate help for.
And a lot of that has to do with post-COVID, and I hate to use the term post-COVID because we're still in the middle of it. I'm not in the middle of it, but we're, ending it, I guess.
Hopefully.
Yeah, right. But yeah, so it's still involved with that. Okay, all right. Is depression different for an older adult versus somebody who's in their 20s and 30s? What do y'all think? Whoever wants to handle that.
I have thoughts about that. I work primarily with children, and in preparation for this, I was really thinking of the similarities and differences in how depression looks in kids. We do a lot of time teaching parents, anger is a very common symptom of depression in children. And what I have kind of come to find is that it circles back around. And so I think the danger, if you will, with depression in both children and in seniors is really an over acceptance of moodiness for those stages of change, right? We hear that a lot from parents and a lot from caregivers of their parents of like, well, this is just, it makes sense that they're grumpy. Of course, they're a little bit more isolated. It's harder to get out. And, I think part of that really comes from just a universal understanding that the symptoms of depression, they may look a little unique, but there's a common thread. It's isolation. It's a change in mood. It could be a change in sleeping or eating patterns. And I've always told this to people. The best experts are those who live with the individual, who are family and in relationships with that person. So I think that if you're like watching this and you're wondering whether or not somebody that you love might have some symptoms of depression, what I want you to think is like, if you're asking that question, the answer is probably yes. Like, trust your instinct, trust that you are the expert in their life.
Going back to what, I'm sorry, Frank, but going back to what Angela said just a few minutes ago about that, many of our older adults weren't raised in a time when it was okay to talk. It was taboo. We didn't even use the words depression. You just moved on and did what you needed to do and didn't seek help and didn't talk about it. And I think we're noticing, at least in the senior center where people are more comfortable talking about it because they're hearing others talking about it. Many of our senior centers are, 60 and up, some are 55 and up, some are 50. And so you've got all those generations mixed, those folks that are 60 versus 70 versus 80, all in the same spaces, sharing programming, sharing time together, learning from each other, and that peer model of, oh, maybe I don't need to be shy or embarrassed or feel ashamed of the fact that I'm feeling this way, that I'm not myself, that I'm feeling more isolated, more lonely or alone. And maybe there are good places to talk about it, and using, the relationships that are built with other seniors, with staff in the centers who they're comfortable talking to. And that can open up that door, for that conversation to be had, and where the staff can then give the resources to that senior in a less clinical model, really, in a more of a, we want to make sure you are living your best life, and how can we help you? So there's maybe a little bit better comfort level for our older adults to talk about it, or at least get that conversation started somehow.
And that conversation is key, right?
Yeah, absolutely.
Yeah.
I think what Michelle was saying too about the anger, if we see a teenager acting out, we ascribe they're a teenager, they're going through their adolescence. A senior isn't allowed sometimes to express that anger. Why are you acting that way? You should know better. You're an adult. It's real. It happens.
Yeah.
Very good point. Thank you, John. Why is the stigma of mental illness so strong in the older adult community? Michelle, I'm going to hand that off to you. What do you think?
I think it's more of what was said, that we see that in our adolescent and preteen population right now. Those kids are so open talking about mental health. It's the words that they use just very freely are words that I learned in grad school in like a counseling class. So like mindfulness and like these things have just become part of normal language. And I feel like there's a generation gap right now where for many years, older Americans, they lived during the time of things like lobotomies and electric shock therapy before. It still is obviously very, very different, but in the first draft of some of these medical models. So I feel like the quintessential, like One Flew Over the Cuckoo's Nest is a movie that a lot of people think of when they think of mental health in that generation. I think it's going to take just a little longer to kind of reinvent what we know to be true about if you have a brain, you have mental health.
Okay. All right. Angela, any thoughts?
I think that's exactly accurate. And I think, going back to the last question, how we're, working on it for adults, a lot of it is the changing social structures of their home lives and their work lives. And so rebuilding those connections in new places, being at the senior center, Michelle mentioned, sometimes when you're, suffering from depression or feeling that loneliness, you don't have a word for it. You don't fully understand it. And those older adults oftentimes need somebody else to recognize it from the outside. And when they are going to a center or to community events, church events, those type things, and they're around a certain community who can recognize those changes, I think that's what's important. But again, some of the language is really stigmatizing to people who are raised in a different way. And I think it's interesting, when you watch Instagram Reels and TikTok and people are talking about all sorts of ways to start your day in mindfulness. And some of our older adults are very techy and they're right in line with all of this. And some are not so much. And so that sort of like, oh, you might be depressed is very, oh, I'm not, I'm good, and depression to that, not being able to in their structure, whereas it's not always that. So I think part of it is what they understand depression to be and how we can kind of that and mold it to reduce that stigma and allow people to seek the services and help they need.
Good points. Okay. All right. So interesting. You talk about technology piece there, Ange. Kerry, why don't people seek help?
I think in some cases at a senior center level, we see it not too different than accessing help for getting assistance, right? So if somebody is financially struggling and they want to come and talk to one of our social workers and find out if there's programs that they can receive benefits that they can qualify for, they're a proud generation. It's hard to sometimes get them to know, to reach them and say, it's okay, come here, we're open and we want to help you do that. So I think a lot of it is just that. But again, what we've been speaking about right along, which is they didn't learn that growing up. it wasn't acceptable to talk about it. It wasn't normal conversation, like Michelle pointed out, being with the young people now. So I think that we need to make sure we're opening up the avenues. We're allowing folks to express those feelings and treating them with respect. And on the other end, in our medical field, I'll use an example at the center. I had a veteran at our senior center who started coming to activities, and he told me that his doctor at the VA wrote him a script to be engaged at a senior center. That the script was, you needed to come and get involved with people because you are on a fast downward spiral to bad things happening. And that was a wonderful thing for me to hear, that our medical professionals are using senior centers as medicine, if you will, and using programming and being able to get seniors involved in something bigger than themselves helps them to get out of that world of darkness. What is there more than just me being home feeling so awful? What can I do? And that was, he to this day had said, coming to the center was a lifesaver for him. And that's huge to us. And who would know that? Who would think that?
What a great doctor, huh? Wow. I deal with medical notes all the time, which most of the time I can't read. But got to be honest with you, that's a fantastic note. John, we've received our first question from our audience, and I'm going to point it out to you here. The question is, I'm wondering if you ever find that it's not so much fear of stigma, but rather an individual on a fixed income fearing the need for care that will cost more money. Perhaps discuss the availability of free mental health care services.
Yeah, we never want cost to be a factor in eliminating their need for help. So there are services that are available. Here at the Amherst Center, we offer short-term counseling. People come in, a lot of times it's a walk-in basis, and we start talking to them, start addressing their needs. I think too, going back to the last question with just the fear of ageism, that they're going to be judged. So having an open discussion, letting them know that there is help available. A lot of time it is affordable. You can do sliding scales. There are some services that are no cost. It lets them know that there is help that they can get.
Great.
And that if they don't know how to access that help, coming to a senior center to ask those questions is maybe doesn't, again, that the clinical model versus the community model, getting that information from a place where they've already established a relationship, and us being able to then say to them, let's talk about, if it's a fear of cost, let us help you with that. We'll research until we find the places that don't have fees or have sliding scale fees, like John said. So that's a really good point, that if it's financially based, if the reason they're not coming forward is financially based, we need to do a better job of letting people know who come to use our services and use our programs and come and participate, that there's always, we can discuss that and figure out how to make it affordable.
And to add on to that, because that's exactly correct, what Kerry and John are saying, but also a lot of our older adults, specifically those that are 65 plus and enrolled in Medicare, are every year able to change during open enrollment their wraparound coverage care, which isn't something that a lot of working age parent or adults have, because they are whatever their employer is offering. So through senior services and our case management services across the county, it is the HICAP, which is Health Insurance Counseling and Assistance Program, to look at those wraparound plans and look at the availability and what that specific older adult needs, whether it be higher prescription drug coverage because they've had a change in their medical situation, or wraparound plans that include additional coverage for mental health services. And that is open every fall for open enrollment for January. So it's a little bit different for them, but we do have trained case managers that can talk through these options to find providers that will take health insurance, that will lower those costs, and that will meet the needs of the older adults specific to their situation.
Thank you. That's very good information, and we'll be talking about available services, available resources in a very few minutes.
I just have to plug us.
No, good for you, Ange. Good for you. But I also want to talk about families. I can tell you that both of my parents are they're in their early 80s right now. and we have parents who are aging, I guess the baby boomer generation, right? What should we, the sons and daughters of those folks, what should we be looking for? To say, hey, mom, dad, we need to seek something. We need to talk to somebody. Michelle, start with you.
So the sandwich generation is real, right? Because at the same time, you're taking care of parents and children. And I guess my first advice to anyone in that situation is to make sure that the best thing you can do is honestly to take care of yourself first. What we see is that, it's not a sprint, it's a marathon. So being able to keep yourself in good well-being space is really the best thing you can do for your loved one. A lot of times individuals are looking for help for their parents or their children. And, we have very little control over what others in our life do. Believe me, I've looked into this extensively, but we do have a lot of control in what we choose to do with it. So some of the classic symptoms of depression is really withdrawal. So if you notice that somebody's spending more time alone or just more likely to decline invitations to things that they maybe would have gone to, or even if they go, then leaving early. I mean, it's a change in personality, which is a little different person to person. Some people not going is just who they are, and that's always been true. But somebody really used to be like active in the community center or active in church, and now they're no longer wanting to do those activities. I'm curious what others think, but in my opinion, that's one of the biggest and most glaring symptoms that there's something going on.
All right, let me ask John.
Yeah, I'd agree with that. Isolation is a real quick way of identifying that, but grooming, is that they're changing. Maybe someone who's pretty meticulous about their hairstyle, their changes. Maybe they're just not taking care of themselves. They're not coming to the center as often. I might see sleep patterns. They're complaining they're sleeping more. They're not able to get up and attend program the way they used to. Maybe they're not hosting the Sunday dinner like they felt very prideful of. So just some of the family dynamics too change.
Yeah.
Kerry? Go ahead, Ange.
I'm just exactly what they're saying. I think the biggest thing family members can do, especially as we are becoming more national and global and are moving around, and how privileged and lucky a lot of the adult children are to have had parents that encourage them to leave and, explore opportunities, but really maintaining relationships more than just, a single phone call or something, because you want to be able to notice those differences. And any change really could be a sign of the depression, not just withdrawal, even though withdrawal is the main one. But if you're seeing personality changes, there are a lot of things that could happen to older adults. I know we're specifically speaking depression here, but onset of memory-related diseases, Alzheimer's, dementia. So keeping those connections, facilitating a way that you can speak on FaceTime with your family members if you're not locally available, so that you can see them, you can speak with them, and you can see if there are changes, even if it's making friends with some of their friends or keeping in contact with how they work there. I know our senior centers do an amazing job, but as a family member, that's one option we can keep in mind.
Okay. Kerry, do you want to add anything?
No, I just think, coming to a center, they're involved in a group where their friends, they make friends fast. Their friends pay attention. The friends are very good gauges to notice those changes. So a family member, we've had people call the center, the children of some of our members, and say, your mom, my mother better than I do because she's at your center 5 days a week. And have you noticed anything? Or one of their friends has reported something to us, and we say to that family member, and of course we do that in a way where we're not doing that behind the older adult's back. We're trying to engage the whole family in the conversation, but basically to say, if you notice something out of the ordinary, it could be signs of depression. It could be signs of something that if we get to it quickly and we talk to that older adult and we just ask them if they like to share with us, is there anything we can do? Sometimes those invitations to open up a little bit help, just nudge them along. Sometimes it's just good for it to be, the fact that when they're told somebody cares about you. For example, our fitness class, someone hasn't been to class in 3 weeks, and their friends will notice, and they'll come in the office and they'll say, have you seen so-and-so? We're concerned about her. She's never missed a class, and now 3 weeks in a row she's not here. we can give a call to the house. We can try to talk to that senior. Your friends are concerned about you. And just sometimes knowing there's other people who care, give you that I guess that courage to come forward and say, maybe I do need to get some help.
I agree with you, Kerry. My office, I'm right across from our congregate dining site, so I'm able to do almost a daily check-in with our seniors and making sure that they're doing okay. Even if it's just a quick hello, how you doing? Did you enjoy the game? We're making contact, we're building that rapport. And then with the recent snowstorm, we weren't able to serve the lunch, but I was able to call them at home. How you doing? You making out okay? And they came back, hey, thanks for checking in. Really appreciated that. And you're building that rapport on a daily basis. It's so important.
So it's interesting because actually my next question was going to be about our initial discussions when we first talked about, when we first got together and talked. And both Kerry and Ange mentioned about the person-centered focus going on in older adult services and what it means. And it sounds like, you've kind of given me the definition. And John, you just touched upon the whole idea of a check-in. Kerry, give me a little bit more about that whole check-in idea. Oh, we lost your volume. Uh-oh.
Sorry, I was muted. So a couple examples. We at the Senior Center are blessed to also have many older adults working for us. Not only do they come to the center, but they're also employees of our center. So they recognize that I have a purpose, right? I get up in the morning, I have a place to go to work. I get up in the morning, I'm making a difference in people's lives. That sense of purpose, it gives me something to do. It gets me a reason to shower and get dressed in the morning. And we've even had situations where from very unusual places, we have an employee who her first stop every morning is to Burger King for an orange drink before she comes to work. And 2 days in a row, she didn't stop at Burger King for her orange drink because she was picking up supplies on her way in. And I got a call from the employee at Burger King, part-time young guy, calling to say, Mrs. So-and-so's not here for lunch, or not here for her orange drink before she leaves for work. And we know she works there because she talks about it all the time and how much she loves her work. I got a check-in call about her from a Burger King employee.
Wow.
I get calls from our other members about each other all the time. Or as John said, around that lunch table, so-and-so's not here today. He's always here. Today is our meatloaf day. He never misses meatloaf. Somebody needs to check in with him. So I don't know, person-centered care can mean a lot of things in different realms for health related things. But in our case, it's just, you've got all these people coming to the same place for a lot of the same reasons. We're all about, for whatever brings you in the senior center doors, you're coming in to give yourself that purpose, whatever it is, being better at something, learning a skill, taking a class, stretching your mind, coming to classes. It's our job as a senior center to provide educational. That's the one piece I wanted to talk about too. We need to get better at offering workshops and seminars that are very low key, not drawing attention to anybody, just educating them about the words of today, the fact that they didn't, we're not using those drastic measures to treat mental illness anymore. What are the new things in mental illness? Sometimes you can get a senior to come and sit in, even if they say they're sitting in for somebody else, they want to hear about it because they have a family member. Maybe it is really them. It doesn't matter. What matters is they're getting the information. So I think, we just want everybody, we have a lot of options to check in on each other here.
And speaking about checking in, great segue there, Kerry. You have no idea what you just did. But if anyone is just joining us, I'm Frank Camerata from the Erie County Anti-Stigma Coalition. And I'm joined by Angela Marinucci, Commissioner of Erie County Senior Services, John Jones, Social Caseworker at Amherst Senior Services, Kerry Peak, Director of Cheektowaga Senior Services, and Michelle Abraham, who is Assistant Director of Catholic Charities Behavioral Health. Today we are discussing the state of stigma and how it affects older adults. Everyone joining us, please do take a minute and check out our website, letstalkstigma.org, and maybe join nearly 4,000 others in taking the pledge to end stigma. And I know we're almost at that 4,000 mark. I think we're like 3,995. So hey, if 5 of you sign up today, that would be a good thing. Also, if you are connected with a business, organization, or faith community, you can become an organizational member of the Anti-Stigma Coalition. You can find information for this on the website under the Members tab. Now, back to our panelists. While I was chatting, I got a couple of questions, and one goes back to a few questions ago. And the question is, when speaking with an older adult who had had traumatic experiences with mental health assistance in the past, such as electric shock, being locked away, how can you explain or show that things are different now? Who would like to handle that one? That's not an easy question.
Well, it can be through very, the presentations and things that our senior centers offer. Some of them are online, some of them are in person, bringing in speakers from current mental health care agencies who can really educate the seniors on how things have changed. But also it can be, again, through organic conversations at a table, other members discussing. I go to counseling once a week. I never thought I would be doing this. Back when I was a young person, people would just use words like we're crazy and we're not going to talk about those things and shut us away. And they will talk about that very openly. And a senior who's struggling with accessing some help might hear that and say, wait a minute, if they can do it, I can do it. So some of it is that way, to have the conversation. Sometimes if you as an adult child want to talk to your parent or a family member about it, I think maybe you can get involved with the senior center staff. Most of us have an outreach worker or a director or somebody who can help you have that conversation if you're not comfortable how to get it started. So that's also a good place if you're not sure how to talk to them about it.
I think word of mouth is huge. I was having a conversation with our executive director recently, and she shared how someone on a throughway exit brought in a member. They were just a stop. They had a conversation, talked about where they were going or where they had been, and mentioned how good their experience at the center was. And once that happened, just start getting people coming through the door, checking it out, finding out what's available, having a newsletter, having it out there in the public eye that we're available, we're here to help.
Okay, great. Michelle, would you like to comment at all?
I think peer-to-peer is really the power of peer-to-peer is monumental, right? So if the faith has been lost in the system, hearing it just from the professional is not going to be quite as credible as hearing it from somebody else. I do think that I know I personally spend quite a lot of time apologizing for the mental health system, especially, we're always trying to improve and make it better. So I know that's been really validating to not get minimized of like, oh, it probably wasn't, how many people really got electric shock therapy, but rather than people did. I mean, some of the different ways that we used to treat depression, now we look back with like, oh, wow, that's really barbaric. So to acknowledge, and there's a lot of articles out there, there's the research and data to support why the changes have been made, and that not only are they different, that we've really gone full circle from like, it's not just we changed the practice a little bit, like we completely revamped the way that we are looking at and treating depression than we used to.
Okay, Angela, I'm going to switch on you. I know you were about to jump in with an answer, but I'm going to give you the next question. Actually, how can you start the conversation with a parent as an adult child?
So I think kind of goes back to what Michelle was saying, but I think that it wouldn't be peer-to-peer when you're speaking to a parent, but speaking about your own experience. And hey, I noticed I was going through a rough time, or for me personally, right? Winter always starts to drag me down. And I think when you draw it in on yourself and be like, how have you been feeling, and open those lines of communication at a point of vulnerability, I feel like people are more likely to see them. The other thing that I often recommend, we get a lot of calls from children of older adults, is for that child to find something that they think their older adult may be interested in, whether it be a University Express class or a card game at a senior center, a church volunteer group, and say like, oh, hey, Mom, I came across this. Is this something you'd want to do? I think it'd be great for you. I'm currently reading the Surgeon General's book, Vivek Murthy's Together and Creating a Socially Connected World and Fighting Loneliness. And he has an example in there of a child who actually signed their parent up for different volunteer opportunities. So when the parent got the call to do Meals on Wheels, for example, they thought they were just desperately needed and had no idea that the child had kind of worked behind the scenes, but really kind of seeing where they are, opening that lines of communication and talking about it in a roundabout way to get to the core. You don't want to be like, hey, I think you're depressed. What's going on? Because some people don't always respond well to that. Now, if that's your dynamic with your parent, please feel free to go for it. But what I found most useful is to start on a level of, this is where I am, how are you? And also to encourage them to get back to the things that you think they may be missing. And then if they are refusing to do those things, opening that conversation that way. Mom, you've always loved to do X, Y, and Z. Why isn't this something you'd want to do? Is there anything different now? Or what wasn't exciting about that to you? Something like that opens it away to see where they're currently feeling, but making that conversation feel natural and normal.
Anybody else want to share?
Natural and normal are the goal. I think that's definitely the way to go.
Good, great, thank you. Since a few of you work with senior centers, I'm going to transition a little bit. What do you feel is the role of the senior center in older adults' lives?
I think avoiding that isolation is key. Getting them involved, connecting, finding that there's activities that they can do. We provide exercise programs, University Express, nutrition. You're feeding them on a daily basis, getting them social interaction. Like I said, the exercise programs that we offer so much just to get them up and moving in the morning. I hear people saying it was because of the center. I knew I had to get dressed and come to the center. I knew my friends would be looking for me. So instead of staying at home, you get up and moving and getting involved.
Kerry. I guess I also think, we're living longer than we ever have, right? Our longevity, keeps getting, we're going to live longer and longer and longer. And as we retire from our jobs and maybe our social circles among our professional friends and people we met through work are shrinking because we're not working anymore, we need to be able to go outside that circle. And how do we do that? And a senior center is one of the natural places to do that. And I think as a senior center, it's our role in our community to provide that safe place, that opportunity for people to try new things, to experience new classes, to continue to learn. We talk about what is important to living as an older adult. As long as you're going to, how do we do that the best way possible? What are all the things we need to think about now that we didn't need to think about when we were 30 or 40 or 50? And what are the changes that we're going to see? And what better place to learn it than among our peers who are all experiencing it at different stages of their aging as well? So I think, senior centers are people are coming there with those intentions. And let's be honest, it's the fun factor. I mean, you can't discount the fun factor, which is, it doesn't matter how old we get, we're competitive, we want to play games, we want to, I never thought in my life that I would see the pickleball surge that we've seen. I've never seen in my life how many, people would be coming to the senior center for all sorts of different things that maybe senior centers of the past never would have even thought to offer. So I think we need to be able to roll with the punches, to know what our older adults are looking for, and to continue to talk about that, right? Get our members to give us their feedback. What do you need us to be for you? What would you like us to be for you? Because some of it is wants, some of it is needs, and some of it is just, we know better sometimes. Stay out of their way and let the older adults come and do what they know, what they want to do, and offer that safe space to do it. So it's a lot of roles. We wear a lot of hats. We definitely do.
Speaking of that, like Kerry, what kind of hats do you wear?
Oh, so as John said, sometimes we're the cook. We're the chief cook and bottle washer. We're preparing meals and serving hot meals and frozen meals, and our county and senior centers partner really well to offer all those things. Sometimes we're their wheels to maintain their independence. Our van programs keep people from being isolated by allowing them to get to their doctor's appointments, their grocery stores, and places like that without having to ask their children or their neighbors or their friends to take them, so they don't feel like they're bothering anybody to get to be as independent as they can. Sometimes it's simply just the fun factor. What are we offering that they will enjoy doing in their in their older adult years. What does that look like? And truthfully, that's everything everyone else is doing. I used to work in the youth and recreation department. I now work with older adults, and you would be amazed at how sometimes the paths cross. We're offering those same kind of activities for all those age groups. And it's no different with older adults. Why should we assume, we can't be ageist ourselves? Why should we assume they can't do it just because they've reached a certain age? We might have to adapt a certain class. We might have to change the way we offer it. We might have to change the times. We might have to look at, some older adults don't like to drive at night, for example. So we have to offer daytime opportunities, or, so those are all things that the senior centers need to be good at and understand to be able to serve their members in their community the best way they possibly can. So, and our members are very willing to be our volunteers, to help us run the programming. Again, it goes back to that sense of purpose. If I'm a volunteer in the lunch program and I know that, me getting up in the morning to get there to help the meals get served to my other friends, I not only am getting that meal myself, but I'm going to help get it happening for everybody else. That's a great thing. Who doesn't want that? We all would want that. So I think just to be respectful of whatever age they're at, they're capable of doing really whatever they want to do, and we need to help them be able to do that.
So, Angela, do you have anything to add on the role of the senior center? Because this is your
yeah. So these are, and we have some great representation of 2 of the senior centers, but we have 44 dining sites around the county here that are offering all sorts of programming for older adults. And I think just where Kerry ended off, but that purpose driven, especially for older adults in that transition in life where they're no longer caretaking of children, if that had been the bulk of their life, or working, having that commitment to show up somewhere, to be there, that people are waiting for them, I think really helps them to keep that structure, because it can be a little bit of an untethered place when you're trying to figure out where you fit in society in those older adult years. Kerry mentioned it, she was so complimentary, but one of the things I love most about our older adults is that they are very willing to tell you when something doesn't work, or when that's not what they want to be doing, or when your assumption of what an older adult looks like doesn't match them. And I think it's kind of a beautiful thing in these older generations. One of our, it makes me so happy, but over the past 3 seasons, we have had an explosion in older adults enrolling in our fantasy football league, which is now at 6 different centers across the county. And, that's not the things that people think about when they think of older adults. And there are some older adults who had never done it before, who just showed up because a friend was going, or they were seeing how it worked, and they've gotten involved. But it also, unintended consequences as we build these programs out. I spoke with the winner of the Akron League last year, and it gave her something to speak to her grandson about, who should she drop and play, and that intergenerational programming. Our senior centers really are that hub and that community connection. And one of the things, in a different way of this reducing anti-stigma, I think a lot of people don't think of a senior center when they're in their 60s and they're active. They think, oh, that's, for later. And then you get there and you see a cardio drumming class. You see, Kerry has an entire kind of like workplace with painting and pottery and all those different things that some older adults are interested in. And building those connections with people who have some interests is just so easy when you have a location. And thankfully, we have directors that are here to facilitate that, to try new things. We had at Cheektowaga in the spring, oh my gosh, was it almost a year ago, Kerry? Goodness. A pancake breakfast where we had people serving pancakes and using Erie County syrup to try on their pancakes, and talking about the Sugar Shack and the parks and giving them those opportunities. But, Kerry was like, come on in, use our kitchen, let's make this work. And just trying to see what people respond to. And if it doesn't work, so be it, you move forward. But sometimes it doesn't. I just think that the role of the senior center in lives of older adults is huge, because it opens up so many different options for them.
And I think we have to also remember the pool of resources we have at our fingertips. Those older adults that have skills, from whether it was their profession, whether it was their child rearing skills, whatever it was, we need to make sure we're tapping into and making sure they know we need their help. We appreciate their input. We know that they have, in some cases, more knowledge about things, and we want to tap into that too. So I think it's a good place for them to feel feel wanted and respected and still useful if they're not.
Good. John, go ahead.
Yeah, I'd like to kind of piggyback off of both Angie and Kerry, that the use of the centers are great. We recently opened up an intergenerational center at Northwest Amherst Community Center. It's been great. We get the opportunity to work with some of our younger seniors, those still raising families. I have a grandparent kinship program that I bringing in families, and on February 20th, we're going to do a family support night, bringing in young kids, families, seniors. And as Kerry said, our seniors have a wealth of knowledge. Unfortunately, when we lose a senior, we lose a library. There's a wealth of knowledge. A lot of our seniors are teaching classes here, exercise programs. It's great resources that we have, and I just wanted to piggyback off of that.
Thank you. Angela, I'm going to come back to you because I just got another question from one of our listeners. If your loved one is not able to go to a senior center, are there other opportunities for connection within our community?
Yes, absolutely. And that's awesome. So one of the things that we found during COVID-19 is how our virtual and our hybrid programming really worked for some older adults, for whom that, especially those homebound older adults, or for those that aren't yet comfortable to go to a center, or transportation is lacking, whatever reasons. We have continued on in virtual programming for a lot of our University Express classes, with recording different classes that are available on our website to, again, just stimulate that mind. We are currently working, Cheektowaga is one of them, with a number of partner sites to get technology in each center that will allow them to interconnect with each other, as well as with homebound older adults. We have numerous programs through RSVP, which is AmeriCorps Senior, Retired or Senior Volunteer Project, where people can volunteer either at different locations if there's something closer to home or something that they wish to be doing, or to find other opportunities that they can do from home to build that connection. We have friendly call programs, things that allow older adults to call each other as part of working with Catholic Charities there. Just a number of different resources that we have available through our website to kind of meet people where they are. One of my favorite examples is a little bit different than I think where this question was headed, but during the pandemic, we started our Club 99, which is our adaptable fitness class, and we were doing it on Zoom from inside the RAF building here in downtown. And what we found was snowbirds were logging in Florida, that they attended the classes in person here at home when they were here, but while they were away, they still wanted to see people and still participate in those same things. So we have continued to offer that virtual programming, and we're looking forward to more and different ways to expand it. We've done, I think, 2 now trivias between different centers where they make a team and then they kind of compare to each other. And our hope is to eventually get that to include homebound and other adults. So again, lessening those socioeconomic differences between some of the centers, but also bringing in the older adults to kind of meet them exactly where they are and what works best for them.
Great. I want to bring this back around to the stigma piece. And Michelle, I'm going to ask you this question. What can we do today to educate the public to help older adults to reduce stigma?
I would say ask the question. And somebody had said this earlier, that the best way to ask the question is by starting off by offering information, right? This is how I'm doing. This is what I've experienced. And I'm just wondering, how are you doing? I think that's how we break stigma. We make it normal in the younger generation, it's very normal for them to do mental health checks on each other.
Okay. Right. John, anything to add?
Getting the word out, like you said, ending the stigma, but letting them know what we are about, open discussions, having discussion groups. I think that's, like I said before, the seniors are a library. Value the senior as opposed to putting them off in a corner, getting them to speak for themselves and show what they have to offer.
Okay. All right. And Kerry, how about you?
And maybe just as a society in general, right? Looking at an older adult through a different lens, which is not judging at all. That age no longer is a measure to determine worth, right? We're just because we've reached a certain age, it doesn't mean that we're not able to do any particular thing. We see that more and more. Again, we're aging more gracefully than we ever have. We have more years than we've ever had. So if we're educating anything, it should be seeing vibrant older adults in every role all over the place, right? Whether it's in the media, whether it's at a senior center, whether it's in the workforce, no matter where it is, that the older adult is no longer, aging's not a disease, right? So we can't keep saying, just because they're old, they can't, right? Just because, maybe it's because they're old, they can. And now they have all this time. If they're not working any longer and they're able, we need to tap into that. I think the more we talk about the positive, the more we bring out the value of the older adults in our community. Our population in Cheektowaga is more than 30% older adults, right, in our own community. We need to celebrate that more, and we need to value that more. And I think that will, if we had a magic wand, that would be a really good reason to use it.
I think Ron Reagan said it best when at his interview he was talked about age. He said, "I won't. If you don't bring up my age, I won't talk about your inexperience." I think that our seniors offer a lot.
Thank you, John. That's great. Angela, how about you?
I think that's exactly correct, right? It is a privilege to be getting older, and it is a privilege denied to many. So I think we need to celebrate it and bring out why people are great. I love what John said earlier about their human libraries, right? These world experiences, these differences. And I remember being very, very young and asking my mom if she was alive when MLK was alive. And I think, and she was flabbergasted and of course, very offended. But for my children, that is something that is, it's just incredible to think about what time looks like and how that works, and really celebrating our culture in America and Western societies was so focused on productivity and capitalism and continuing on, which is all great things, right? We have amazing progress and things happening, but I think that too often what gets lost in the shuffle is that human element of it. And I think that when we draw back to what these people have experienced, what they've gone through, the similarities and the differences of those times, my children have never seen a telephone on a wall, and things like that. I think that when we can celebrate our older adults and those older generations and bringing them into the fold instead of afterthought or the one more thing, I think it helps everybody. It reduces the stigma. It also makes people be more accepting of others, because the more that you're around people with different experiences, the more you can be open to all sorts of perspectives, whether or not you agree or disagree. I think that human element and that connection is so valuable. And so I just think that we need to talk all the time about how awesome it is and how lucky we are to be getting older every single day, because it's denied to so many people.
That's great. Thank you, Angela. Well, as we wrap up our discussion today, I'd just like to offer each of you an opportunity to provide a few brief closing remarks, about 30 seconds each. And how do you communicate your services? How do people know that, that your services are out there? If you could share that with us. We'll start with Michelle.
Sure. So the two programs that I would love to put on anyone's radar is, as Angela spoke about, we have what we call the TAP program, the Telephone Assistance Program. And it's an opportunity for individuals to just get call check-ins from community volunteers. They're also always looking for volunteers. And so it could be one of those situations where you spend some of your time calling other seniors. And the other one is Project Hope, which is a care management program for individuals above age 60. So I think these conversations that we had today is a great starting point, and I'm confident it's not going to be the ending point, and that these conversations will just continue to happen around the dinner table.
Thank you so much, Michelle. That's great. And John, how about you?
I think our online presence is important. We have a webpage, and we utilize Facebook. We're in the local papers, letting the public know that we're available. We're there to help. Again, word of mouth, letting our members speak for us, and out in the community, they do a good service by letting others know how good we are. So I think that's important.
All right, very good. Thank you, sir. And Kerry.
I feel like I'd be repeating everything else everybody else said, so I'll say ditto, but I'll also stress again that word of mouth, that our members are our own best advertising. But I think just word of mouth in another sense, which is, if an older adult isn't wanting or willing to speak their mind, try to get them somewhere where they're comfortable, able to do that. I noticed in that same question somebody asked about if they can't get to a senior center, what other opportunities are there? Even if they can't get to a senior center is still a great resource for them, even if it's a phone call, to learn that person. We need to know individually what that person's needs are and how we can individually assist them. And we may have resources for them to bring the community to them if they can't get to us as the community. So I think that's important. But just overall, I think, we're in the same places everyone else is. If you want to learn about senior centers, Google is our friend too. You can go online, but picking up our newsletter, looking at what your towns have to offer. The nice thing about things these days, again, very different from the past, is there used to be very strict rules on residency. If you lived in Cheektowaga, you could only come to the senior center in Cheektowaga. It's not like that anymore. So seniors who enjoy one particular activity could do that same activity 5 days a week at 5 different senior centers if they wanted. So that's a beautiful thing for our older adults. The opportunity to explore that is bigger. The places they can go is more vast. So I think that's great. And I just think we need to just keep putting the word out about that it should be a joy to grow old, and that it's not for sissies, but we certainly know lots of great things that can help our older adults make it the best times of their lives.
All right, Angela, I'm going to give you the next to last word here.
All right, perfect. So everything that everybody has said is perfect. We are using social media channels, our website, but I do just want to plug our phone number. We find older adults often prefer the phone. Some do, some don't. So our main number, it's been there it is at the bottom, but 716-858-8526. That is our Monday through Friday, 3:30 to 4:30 p.m. answered by a live case manager. We call it our No Wrong Door line. This fall, we were helping a lot of older adults find their polling places because some had changed in areas of the county. We have done everything from make vaccine appointments to connect people with the Department of Health for rodent control. So it's really just open. But those case managers can evaluate based on situations for proper programming, can refer you to your closest senior center, can talk about other nutrition programs that we have and how to get involved. So if somebody doesn't know where to start and would prefer to speak to a case manager, please feel free to give us a call and help us point you in that right direction to succeed from there.
Very good. Thank you so much to my panelists. You were all so really informative and really, really terrific today. I really appreciate it. And I'm sure the audience did as well. As a reminder to our audience, we need you to take the pledge to end stigma by going to our website, letstalkstigma.org. If your organization would like to join us in our cause, there is information on the website as well. Just click on the Members tab and find out how. Together, we can reduce stigma and create an environment of support where help seeking and help giving are the norm. Once again, I'd like to thank our great panelists, Angela Marinucci, John Jones, Kerry Peak, and Michelle Abraham. I'd also like to thank everyone behind the scenes, Mike Telesco from Telesco Creative Group for his vision and technical support, Carol Doggett, and Karen Karaszewski from KKPR Buffalo for their support as well. So on behalf of the Erie County Anti-Stigma Coalition, until next time, I'm Frank Camerata. Stand up to stigma, and good luck on your wellness journey. Thanks again for viewing. Take care.